with the objective of helping you hit the refresh button on emerging trends on a range of topics. This Sunday too, you'd be delighted to know that we have one illustrious speaker. With over 60% of our alumni being entrepreneurs, it was an organic decision to float AABN as a dynamic entrepreneurial ecosystem that caters for domestic and global markets. It's not just a talent pool, it is also a space for established entrepreneurs to network and for the aspiring ones to galvanize ideas and support. Today, we have an illustrious guest speaker, Dr. Ambalam Chandrasekaran, to deliberate on the topic Yoga Care Rehabilitation, Comprehensive Cardiac Care Program for Prevention and Management of Cardiovascular Health. Coronary artery diseases carries a high morbidity and mortality worldwide, and exercise-based cardiac rehabilitation programs play a large role in secondary prevention. Exercise-based rehabilitation programs are expensive, and in certain subgroups, uptake is poor. Yoga has been suggested to show improvements in cardiovascular health, which would support its use in cardiac rehabilitation programs. The addition of yoga to rehabilitation program improves the subjective feeling of cardiac health and quality of life. Yoga-based cardiac rehabilitation might be a suitable alternative rehab, especially in communities where engagement is likely to be better and where patients are therefore likely to persevere beyond the initial program. It could also be considered as a low-cost alternative where infrastructure and recruitment of the MDT may be challenging or where distance to facilities is a barrier to treatment. The benefits in automatic function may also be important in other areas of cardiac rehabilitation, most notably in the setting of heart failure. I have the pleasant duty of introducing and welcoming Dr. Ambalam Chandrasekaran to this interactive session. Dr. Chandrasekaran is a board-certified yoga and naturopathy doctor with additional training in public health. His interests are to the efficacy of yoga and naturopathy system of medicine, especially the lifestyle components for its applications in various chronic health conditions. Currently, is coordinating various multi-center randomized control trials of cardiac rehabilitation based on yoga in various cardiovascular conditions, including acute myocardial infarction, heart failure, pulmonary hypertension, etc. He has also contributed to evidence synthesis and dissemination activities at CCDC. He is establishing networks for global research on applications of yoga-based programs in non-communicable disease prevention, management, and rehabilitation. His works are published in several top journals such as JACC, Nature, etc., and presented at various scientific conferences. He is a resource person for training and capacity building in several central and state government organizations. He is a member of American Heart Association and European Society of Cardiology. Currently, he is a research scientist at Public Health Foundation of India and heads the Yoga in Public Health Research Unit at the Center for Chronic Disease Control, New Delhi. He is pursuing his fully funded doctoral program at the Global Health Research Center for multiple long-term conditions at the University of Leicester, established by National Institute of Health Research, UK. Dr. Chandrasekharan's knowledge of the topic and his ability to engage the audience will ensure that attendees today will walk away with several key takeaways. It will ensure that your attendance at the webinar today was more than worthwhile. I'm not going to make you wait longer. We'll let Dr. Chandrasekaran take over and regale you with his astute experiences and fresh ideas. Thank you and welcome you, Dr. Chandrasekaran, once again.
Thank you for that introductions, and it's my honor to be here among several entrepreneurs. Thanks special to Suresh sir. So he's my teacher in my public health school, and thanks all of you for taking time in this Sunday and joining us here. To begin with, I want this to be an interactive session. For the first few sessions, it will be really helpful to understand, because many of you may have some cardiac problems and things. So we want to, tease out your personal experiences to build this, the presentation over time. So I'm having some, I'm a researcher by training, and I'm not a public speaker basically. And also I have never pitched upon a group of entrepreneurs. So excuse me if I am too technical, and please stop me whenever you want. and being a researcher with all these usual things. So I have to present my ideas. 1 second. Yeah. So I will be using some of the slides to have an interaction. So hope that works. Uh, so let me share my screen to begin with. So hope you can see my screen.
Yes, sir.
Yeah. And other disclaimer, I used to speak very fast. I understand that is my limitation. I'll try to be slow. And if at all there are any, if you're not able to follow me, please stop me then and there. Because it's not a deductive lecture. It's about understanding, what we are trying to do. So, before we start, I want you guys to think of like how many of you are having any heart problem?
Can you go on slideshow mode, please?
Sorry, sir.
Slideshow mode. It is a seeing this.
Yeah, no, this particular one is an exercise, so I want to have it like
Sorry.
vocal.
Okay.
Yeah, yeah. Thank you. I got your point. So how many of you have a heart problem? Have you been told ever by a doctor that you have a heart problem?
We do not know, doctor.
Not yet. Good. Great. So almost 50 participants and no one have a heart problem. That's great to hear, actually. How many of you know of a heart failure, heart problem patients? How many of someone in your circle, in your friends?
I myself.
Oh yeah. Yes. Yeah. Anyone else? Okay. Okay. So you may not have the lived in experience. Let's go to the causes. What do you think can cause a heart attack?
Too much worry and stress, doctor.
Okay. Let's list down all the things, whatever you are trying to say. Stress, too much worry.
The lifestyle and the food habits.
Lifestyle. Can we go little detail into this, please? Food habits is one.
Lifestyle could be like if you are more sedative mode and not making much of your exercises on a daily
Sedentary,
routine.
Sedentary.
not much. Can I write it like physically inactive? Physically
Probably due
active.
to the mode of work and whatever the nature of work, that also contributes the lifestyle.
Okay. Nature of work. Sorry. Yeah.
High cholesterol.
Good. High cholesterol.
High BP, sedentary lifestyle, lack of exercise, eating junk food.
Okay, those are mentioned.
I'm sorry. I
Junk
just,
food.
okay.
Yes, please.
Thank you.
Yeah. Anything more? In your understanding, what causes heart attack?
Genetic reasons, family
Genetic.
history.
Yes.
Fatty liver, doctor.
Fatty liver.
What about inflammation?
Yes. Inflammation.
High sugar.
High sugar.
Thickening of the arterial walls.
Thickening of arterial wall.
Obesity.
Obesity.
Smoking.
Good. Smoking.
High body mass index.
Kind of obesity we can call.
Alcoholism.
Alcoholism.
Smoking.
Okay. Anything more? Another 1 minute.
Overthinking.
Overthinking.
It is worry, hurry and curry.
Worry, hurry, and curry. Am I right?
Even heredity.
Sorry?
Heredity. From
Failed.
generation. Yeah. Heredity from generation.
Hereditary, yeah, that's genetic or family history. Okay, last 20 seconds.
Lack of sleep, insomnia.
Very good. Lack of sleep. Okay, so let's stop this here. So, as for your understanding, so now you have seen variety of factors can cause heart attack. Some of the things what you have mentioned here, for example, inflammation, and then thickening of arterial wall. These are actually the process. These are not the causal factors. This is in the process. Stress causes, heart attack or the heart problem through inflammation and through thickening of arterial wall. So we cannot, purely call them as a kind of a, causes. Now, when we speak of so many, causal factors like this, can we address everything with pills, with medicines, or with surgery? That's where the prevention and the rehabilitation approaches come into play. Yes, there are several wonderful drugs, especially 4 major drugs for a patient who has got a heart attack, which can improve multiple facets of health. Like, you can improve your quality of life, your chance of death can come down with the 4 important medicines. But can we completely, bring the risk as like a common man? No, we need multiple aspects to be working. That's where we have something called as a rehabilitation program, come into play, which can address majority of this practices, majority of these causes through some of the, like basic self-care approaches, which is like changing your behavior and improving, or alleviating all this, the negative effects of everything. And importantly, you have to understand the heart problem is not one-time issue. The block in the heart, develops over years together. For example, it takes almost some 30 to 35 years to develop that complete, block in the heart. With all this risk factor or multiple risk factors or one or the two, the predominant risk factors, it can, it can add to the insult in the blood vessels, and it can, it can develop that plaques, what we call, right? The deposition of fat in the your vessels, which will happen over 20, 30, and 40 years. It's a huge time. And just with few days of prevention and things like that, it's not going to change much, right? So again, it has to be a long-standing kind of a practice to, change or halt the progression of the disease, right? We do not want more obstruction of the arteries or the blood vessels. We do not want the progression. We do not, at least we want halt, right? And reverse if it is possible. To regress the fatty deposits, we need time and energy to work upon. So to add to the causes, I'm just presenting this in a simpler way for you. We categorize these risk factors into two groups. One is the behavioral risk factors, which is in your hands. We call that as physiological risk factors, which are not truly in your hands. Maybe these are the outcome of your behavioral risk factors, but medically, these are the things which are generally controlled in the your medical management, your drugs. For example, people with heart attack will be given drugs for reducing blood pressure. People with heart attack will be targeted to have a good blood sugar control. People with heart attack will be prescribed some statins or other cholesterol lowering agents to ensure a good healthy cholesterol level. People with obesity will be advised for certain medicines or even certain other therapies and surgical interventions to reduce that heightened risk from the physiological perspective. On the other side, we have something called as a behavioral risk factors. So what is the behavioral risk factor what we are speaking about? You have mentioned everything. We are trying to put that into 6 major domains, and other important risk factors are environmental pollution, which is not in our hands. But we can stop contributing to that environmental pollution in a reasonable way within the house. So what are the major behavioral risk factors we are speaking? First is physical inactivity, which is like doing not sitting for a long time, doing no physically active engagements, or not properly exercising, not sufficiently walking, right? So there are so many triads of a physical inactivity. Then we have poor dietary habits. So diet itself is a vast area, starting from what are you eating, how are you eating, how much you are eating, when are you eating, right? So there are several phases into diet. So you have to change all those aspects. So you should eat right. You should eat in right quantity. You should eat in the right time to keep you healthy and avoid all unnecessary components. Then sleep, as someone rightly pointed, sleep is another major component, which is very, very, very crucial. The sleep, again, once again, has several facets. The minimum duration of sleep is good. At the same time, the deep sleep, which is essential, that is also has to be fulfilled. And the refreshment after sleep should also be there. So these are the 3 triads of good sleep. Then stress. So stress is inevitable for life. However, too much of stress or mismanaged stress in terms of worry, in terms of anxiety, tension, all these things are going to have a long-standing impact on health, especially the cardiovascular problem. Then substance abuse, tobacco, alcohol, those things also add insult to the your circulatory system. Importantly, social isolation. Many people, like human beings are social animals, right? We are just animals if we don't have the social interaction. So we live with the society. We need someone to, have that continuous interaction for anything, to have a, kind of a feel good effect, to criticize each other, to be with each other in times of need, to cherish some moments. We need that social interactions. If it is missing, that's going to add a huge insult to the entire, your health. Then finally, as I said, this is environmental pollution, which is which is an emerging risk factor in multiple, chronic conditions, especially the heart attack, especially in specific hypertension cases. So in hypertension, like 20-30% of the, the responsible reason for hypertension is the air pollution, actually. So when we speak of heart failure, heart attack, or people with heart problem, these are the various risk factors we are going to deal with. So as I said earlier, can we manage everything with medicines here? Not at all possible, right? So the medicines will help you for sure, but in addition, it is the individual who has to make that necessary changes to improve their health. That aspect of self-care is the missing gap in the management of patients with people with cardiovascular issues, especially people immediately after a heart attack. So what do we speak in terms of cardiac rehabilitation? So this is a conventional rehabilitation model which is widely practiced in the West. So you have a patient with heart attack. After that, the person is expected to go for exercise training. They will have a formal, thorough evaluation of multiple, risk factors. They will be given a nutritional counseling. If their weight is too high, they will, go for weight management strategies. They will be strongly advocated to keep their blood pressure in control. They will be strongly advised to, keep cholesterol levels in healthy range and a good blood sugar control and avoid any tobacco. Tobacco use of any kind is strongly discouraged in patients with heart problems. Then the psychological management by engaging you with psychologists or having counseling or other aspects. Then finally improve your regular routine, day-to-day physical activity. So exercise training is something like they bring the patient to the hospital and ask them to walk in treadmill with all the, the electrodes checking your health over time, right? So during the practice. The physical activity counseling is on the other way to motivate you to walk. If you are walking sufficiently, they will ask you to go for next set of, a little, increased intensity practices. And finally, eventually, you have to be living healthy at your home. It is not just exercise training in the hospital. It is about living independently at your house as well. So this is expected out of a cardiac rehabilitation program, which is widely practiced in the West. Now, if you are coming to the cardiac rehabilitation program, what we are doing in our research studies and what we are advocating currently is a yoga-based rehabilitation program. And the moment you think of yoga, that also can address all these basic elements, right? Yoga also has asana, which is physical postures, which have some effects on your strength training, which is good. Then, yeah, obviously, patient assessment is integral to any clinical, management. Yoga-based advices revolve around dietary advices such as, vegetarian diet and then, being moderate in intake, all those aspects. And practice of yoga and lifestyle approaches have shown to reduce the weights, blood pressure, and cholesterol, as well as our sugar levels, healthy good sugar levels as well. Right. Then yoga avoid, strongly advocates to, keep away from tobacco and all other, substance use. Then we have psychological management. Yoga is one of the renowned methods for reducing stress, right? So to reduce mental health outcome, to improve mental health outcomes like anxiety, depression, or fear of death, anger, irritability, everything can be improved with yoga and other lifestyle practices. And finally, the physical activity counseling, which is there. So we have developed this, yoga-based cardiac rehabilitation in a scientific way, touching the roots, the ancient roots as well. So this particular program is expected to provide all these things. But the major difference is in the left conventional rehabilitation model, we need specialty doctors for specialty people for each and everything. For example, for you to train one person in treadmill in the hospital, you need a physical therapist. You need maybe a physiologist to monitor your health. And then you need a dietitian. You need a internist or like internal medicine doctor to have that the control over risk factors and things. Then a psychologist or a counselor to keep you away from mental health issues and tobacco things. So we need multiple disciplines, and sometimes we need occupational therapists to reorient you to the work completely. But this kind of multidisciplinary requirement is not feasible for an Indian context or low middle income context. And another thing is like people with heart problem here. Can you tell me how many times you have met your dietitian or how many times you were asked to meet different people? Anyone who has with a heart problem who has met, I met a dietitian, I met this one, I met this people.
Doctor, I have no heart problem, nor have I consulted any dietitian, but I follow a certain type of diet, vegetarian diet. In the morning, I have 2 parts of breakfast. First part consists of raw vegetables, fruits, seasonal fruits, little bit of curds with flaxseed powder and soaked peanuts. And part B will be the cooked breakfast. That will be a little bit. This is what I follow, and I've been having good health. I should say I'm nearing 70. My mom had heart problem. She expired. To my elder brothers, they underwent heart surgery. They're okay. But I have defied all this.
Excellent. Great, great to know that. So your brother consulted how many experts like diet ke liye for the for physical activity? Any idea? So basically, the issue is even in Western developed countries when we have all the yeah. So the expectation is the experts in their respective domains know the best of the information, but it is creating a chaos, or it is creating a difficulty among the participants to navigate through these multiple experts. Already we have a fragmented care. For heart, you will go to the cardiologist. For diabetes, you will go to the endocrinologist. For for knee joint or joint related problems, you will go to an orthopedician. When you have these many specialty doctors addressing these things, in addition, you have to make some 5 or 6 consultations for other things. It is really going to be a tough thing in navigating your entire clinical consultations. So it is a chaos in some extent when we have multiple people addressing your health, especially in terms of rehabilitation requirements. So that's why this particular aspects, when we deliver it with a with a single person, it can be more effectively delivered, understanding the holistic nature of the requirement of the patients, and it can be the transformation can be much more rigorous and stronger. So you can deliver effectively all these things with a trained yoga naturopathy doctor who has already has sufficient trainings in all these domains like physiotherapy, dietary requirements, and then psychology. So all these basic things are being addressed in the curriculum, so it becomes easy for an Indian context where we have this enormous human resource in yoga naturopathy to address this cardiac rehabilitation wherever it is feasible, wherever it is okay. We can have this multidisciplinary cardiac rehabilitation approaches, but when we do not have it, we can always think of an potentially low cost application like yoga based rehabilitation program. So now let me take you through a simple kind of a model of care, what we are actually trying to do here. Now, a patient got a heart attack. What we want from them, or what is the expected outcome of them, right? What is your expectation? Call that as a secondary prevention goal. A person got a heart attack. What do you want from them? What
He
do
should
you want to
become
do?
normal
You should become normal. Excellent.
and lead a normal life.
Excellent. Anything else? Right? Okay, let me navigate through you. First thing is, as Sir was telling, we have to be as normal as possible in terms of physical fitness, your functional capacity, and self-rated health, right? That self-reported health. And in a long term, what we are expecting, the chance of their repeat hospitalization or the chance of their death or chance of any other, adverse event, we call that in medical, in medical terms, adverse event, we call that as a safety issues in terms of these patients, right? And finally, the cost and resources for maintaining their health. This is a secondary prevention goal. So if you have a patient with heart attack, what we want them? We want them to have an improved physical fitness. We want them to improve their functional capacity and self-rated health in terms of their overall day-to-day affair. In a long run, what we expect, we do not want them to die earlier. We do not want them to go into a hospital admission again with a heart problem or any other reasons. And we do not want them to spend much, right? We have to reduce their cost of healthy living. So, but most of these things cannot be addressed in a daily or in a routine clinical encounter, right? So at every given point of time, whenever you are meeting a doctor, we cannot check all these factors, right? What is your probability of death? what is your probability of getting a heart, admission again. We cannot look at that, right? So what we look in a clinical encounter is like when you go to your doctor. So what are the things you measure in that hospital? Your interaction. So we call it as an intermediate outcome. So our expectation is when this is under control, over a long run, you will have all these things in place. For example, the doctor will look for your symptoms, whether you are having a chest pain or not, whether you are having any swelling in the legs or not, right? What about your frailty issues? Are you feeling that issue of frailty? Sometimes they can ask you to go for a treadmill test. That's to understand your exercise capacity, how much your oxygen intake capacity is, all those things. Then they can look for your, waist, circumference, BMI, or as I said, the edema is swelling in the, swelling. It can be in the legs, it can be in the abdomen, in regions. And importantly, the medical risk factors is how well is your blood pressure controlled, how well is your blood sugar controlled, how well is your cholesterol levels controlled, right? And also they can ask for you whether you are, if you are taking alcohol or tobacco in the previous times, are you, devoid of that behaviors or not? And finally, they can randomly check, are you anxious, depressed, or are you having any other, psychosocial issues? So if you go to meet a cardiologist or a doctor for your cardiac care, generally they will look at these aspects. If a good cardiologist will be trying to look at all these aspects. And due to paucity of time, people will stick on to the, your blood pressure, sugar, and lipid, related things. And others maybe, not routinely checked, but maybe once in a while it may be checked due to the paucity of time. Then what we propose is when you have a good behavior in these factors, the expectation is your intermediate outcomes will be in a very controlled position in terms of rehabilitation or in terms of lifestyle approaches. What are those? We saw the causes for the heart attack or the cardiac problems. So the behavior is the ulta of it, right? You have a good physical activity, you have good healthy eating behaviors, you are adhering to your medications, whatever the doctors have prescribed, you have not used any tobacco, alcohol, your stress is under control, your sleep is good. You know, all these things, our expectation is all the outcomes will be managed by itself, right? Now, when you fail in these behaviors, when it is not adequately, you are not having that adequately, then what we have to do in a rehabilitation, we have to fix that gaps, right? When you are not having physical activity, we have to give something like a physical training for, okay, come and do this asana, come and do this some yoga for some time, you come and do some treadmill for some time, right? And then if you are not having a good diet, we can give dietary counseling, or we can give you a regular diet so that you can change your dietary behavior. Similarly, the risk factor management, how we can bring effective control of your medical risk factors, plus through the behavioral approaches, like through the changes in your exercise and things, how you can control all these things. And whenever a person is still continuing with their substance use like tobacco and alcohol, we can advise them to we can counsel them. We have scientifically evaluated tested methods with which you can bring this tobacco cessation and alcohol cessation. And finally, the sleep and relaxation, psychosocial counseling and things like that can be given if you have any stress related issues, and the social isolation related issues can be started with family counseling and things like that. So in a nutshell, when we deliver a set of these practices to target these behaviors, if your behaviors are in a very good expected levels, then the intermediate outcomes in your regular clinical encounters should be in a very controlled manner, and over a long term, this should be translated to meaningful benefits in your cardiac care. This is the theory which is proposed for cardiac rehabilitation and the secondary prevention goal is here as a whole, right? So with this approach, what we have did previously is, so we have did a scientific study. We call it as a randomized control trial. We did this trial in 3,500 patients with heart attack. in these patients were recruited from 24 hospitals across the country. The project was supported by Indian Council for Medical Research and Medical Research Council UK. It was a very long project. So it started in 2012 and ended in 2018. So what we found, first and foremost thing is this rehabilitation program, because one of the commonest advice for patients after a heart attack is you should take bed rest. Even a small walk, they will say take rest, right? Just take rest without any clear directions on when you should stop rest and start the activities. That's a very common thing. So even your walk is considered as a risky behavior, and most of the patient caregivers will restrict the patient not to walk itself. So any kind of introduction of physical practice is not seen conventionally in Indian context and in many of the low resource settings. So we should demonstrate that whatever we are doing is safe for the patients first. Whether it is beneficial or not, that is secondary. First, we should say that it is safe. So we prove that it is a safe program. And can the patient do this program? Yes, we have demonstrated all the patients can do such kind of program where they can do some simple yoga practices, and they can along with that do all the dietary changes in that necessary domains. And what we found is it improves the quality of life for sure. And we use the term called as return to pre-infarct. Like for example, you got a heart attack. Can we make you to go back to your normal life as like you were before the heart attack kind of a situation, right? So we found that people who are following the yoga based rehabilitation program can better go to pre-infarct daily activities than the people who are not following this. And then like the proportion of people who were living and proportion of people who were not having hospital admissions were almost in the were numerically different, but we use the term statistical significance is not achieved. We can get rid of that. But what we add is people who were adherent to the program, like people who practice yoga regularly and then stick on to the dietary changes, they have the most benefits in the study. So what we concluded is we have this rehabilitation program. It has a huge potential to change into the alternate for the conventional cardiac rehabilitation program, which may be to needs of cardiac rehabilitation. For example, we can say like out of 1 lakh people who may get a heart attack, who are getting nothing in terms of cardiac rehabilitation, our program can reduce this, effectively this gap. So this is my last slide. What I am trying to say is this yoga-based rehabilitation program, what we call as a yoga care, is comprising of your, to address the needs of physical inactivity. We will give yoga practices. We will give training on counseling and other physical activity as well. We will improve your, dietary habits with, with the focus on sleep and stress and relaxation. We will target the stress management individually, and we will also focus on cessation of tobacco, alcohol, and the substance abuse. And finally, the social isolation has to be addressed, bringing the ends are delivered by a yoga naturopathy doctor who is having the training in this place. And coming to who can take this rehabilitation program, although we recommend, like the trial or the study, what we did is in patients with heart attack. This is, as I said, as I said, begin. This is a continuum, right? This takes 20 to 30 years to have a heart attack, but the underlying problem of all these things are there everywhere, right? So rather than getting a problem and doing this, you can start this now itself, right? Because most of them will have at least 1 or 2 of these issues. So it's better to have kind of rehabilitative approaches, as a regular activity in your day-to-day affair. That will prevent you from getting a heart attack, and that can help further in implementing further getting a heart attack. After you get a heart attack, you can prevent the chances of that as well. So I conclude with this. Thank you for the time for the presentation. So now we are trying to expand this into the community. Given that, a drug which is proven to be effective will be upscaled very quickly, but behavioral interventions will be always taking the backstage. So how we can upscale this kind of a program to the community is a big thing of us. So we are working on this, and we have so many entrepreneurs, so your suggestion will be really, really valuable for us as well to, take it forward. Thanks again.
Yes, sir. Thank you. Thank you,
Over
Dr.
to
Chandrasekaran.
Participant.
Yes, sir. Thank you. Thank you very much for the session, sir. We can have question and answers now, sir. Participants, you may please unmute and ask your questions, please.
Yes, please.
Dr. Chandrasekaran, it was an excellent talk. Congratulations. I have a question. Some people say that, alcohol in a limited quantity acts as a vasodilator. What do you say about this one?
So in terms of way that, there is some amount of alcohol, for example, we derived a study that is called as the inter-heart study, which looked at various risk factors and how it could have contributed to heart attack. And in that they mentioned alcohol as a protective. Sir,
Is protective.
sir, you were telling something, right, sir?
No, you can close the
Yeah. So in that
video,
study, they said
you can close the video so that your voice will be much clearer.
Oh, okay, great. I'm shutting the videos. I'm in a low bandwidth place, so I'm switching off my video. We can speak. The idea is, in the Interguard study, they found that small amount of alcohol is actually beneficial. It acts as a protective factor, kind of. But after that, there are tremendous, huge number of studies. So once it comes to alcoholism, we have tremendous evidence to say that it is bad, no doubt.
Yeah. Thank you.
But to what extent is the question? Little beneficial, but not in other conditions. You take brain health, you take liver health, you take other things. It is getting a really biggest culprit. So better to avoid if at all if possible. Random instances of alcohol intake is never a problem, but regular routine behavior is really a kind of a tough thing to play for your health.
Okay. Thank you.
Thank you, sir.
So
Good morning.
There's a question in the. Yes, please. Yeah.
Okay. Good morning.
Yes,
this
please.
is Saravan from.
Go ahead.
Yeah. Sir, actually, it was a nice, excellent, information for all of us, I hope. My question is, in case of walking, they said you need to have at least 120 to 150 beats per minute of pulse rate or water rate. Is it a must to have a walking or any physical activity to stretch for some more time at a higher rate? Thank you.
I hope. Let me repeat the question. What you asked. So you asked. We have to walk at 100 to 120. That the heart rate of 100 to 120 beats per minute. And what about the role of stretching or other practices? Am I right, sir?
Yes, absolutely true.
Yeah. So let me do. There are two questions in it. The first thing is walking at a pace of 100 to 120 beats per minute. To begin with, what we suggest in the exercise training is we should start, first evaluate the patient about the capacity. We have something called as a target heart rate. heart rate of some X to 70%, which will be gradually increased over time, not quickly. So the important yardstick for their good practices, they should walk to that level in which they can speak. Okay. So if you're not able to speak during you are walking, then that is a right intensity. But to achieve that, you have to start, you have to take baby steps. Don't go to that level, when you have a heart problem, because there's a chance of getting a ruptured block. So you have to do it very slow and steady. When you have a care, we can do it, in a supervised way. We will, the physiotherapist or physical therapist or the yoga natural doctor can monitor you. But if it is not possible, take baby steps, do it slowly, and then reach the stage where you walk to that level. You are not able to speak to your friends. So you can walk with your friends, but not speaking with your friends, right? That's a ultimatum you can reach. That is one way of physical activity. And regarding stretch and other things, stretching has its own role in the health perspective. But only stretching will be sufficient or not? No, not at all. So this is one facet of health, one facet of physical activity, which is another domain which can be practiced frequently, but it is not sufficient by itself. So we speak of at least do walking for some time. We call that as moderate activity. You have to do 150 to 300 minutes per minute. And in terms of vigorous activity, we expect you to do at least some 75 minutes to 150 minutes per week. And then do strength training for at least twice a week. So this is a recommended guideline for any adults, not just for cardiovascular patients. Any adults should stick on to this kind of a model. This is the WHO guidelines for having a healthy physical activity. But in that, stretching is not included because it's like a light activity.
Doctor, I'm very glad that you mentioned
Yes.
of strength training. I do this, about 5 times a week, about 75 minutes each day, 5 days a week, and it has kept me in good health. Of course, 15 minutes of warming up, then about 50 minutes of strength training, and 5-10 minutes of abdominal muscle exercises. I feel nowadays doctors are also suggesting that people who are recuperating should gradually switch over to strength training. Thank you.
Yes. Strength training was not included 10 years before, but it is gaining its place in health in the last years for sure. And WHO, World Health Organization, has recommended this very strongly recently.
Usually what people think is heart attack patient means, you should not lift weight, you should not do anything. Of course, not initially, but after some recovery, he or she should start doing all this. But as you said, thinking has changed in the medical fraternity. And nowadays doctors do suggest strength training, which is a very good development.
In fact, to put it in this way, there is a development from no activity to do some activity. Even now, which is not totally practiced. Not all the patients are, recommended for walking itself. So there's a change. There's a suggestion, but how to do that, how to do it in a practical way, how to take it forward, that is still a missing element. Yeah, the cardiologist, many of your doctors could have prescribed, you could have suggested, okay, change this habit, do that, eat more vegetables. But how do you change that? That is really a practical concern, which requires sometimes hand holding, through tailored diet chart, having some multiple interactions, because most of the dietary changes or most of the lifestyle changes what we are making is not a long-term sustainable practice. If it is not a long-term sustainable practice, then it is a short-term fix, which is not going to help in a long, a disease with a long time for pathogenesis. Like, it is going to take long time to revert also, right? So you go for 3 months of exercise training and stop that. It may have this value for the 3 months, but beyond that, it is going to stop. So there are, all these facets which require a professional, which requires, the rigorous rehabilitation kind of a thing. So people who are highly health literate, doing it by themselves, really are seeing the benefits. But people without that, it is still, yet to be reached.
Yeah. Can I? Hello?
Yes, please.
Hello?
Yes, sir. Yes, sir.
Suresh, sir, go on, sir. Suresh, sir,
Sir,
go on.
please go ahead.
1 minute, 1 minute. It's crowded. I just come out. I'm the rest.
Thank you, sir. Thank you for your great.
Okay. Now the question is, why doctors are not giving a what you call uniform remedy for the problem. For example, if one doctor says go for walking, and another doctor says don't go for walking, your knees, your joints will get worn out soon, and you'll have a knee pain. So don't go for it. One doctor says take chicken, another doctor says don't take chicken. So there is no uniform response to this kind of practices. Why these doctors differ?
Thank you for bringing in $1 million question, sir. So basically, I see it as a, kind of a, the problem of interpreting the evidence which is available. Okay. So that's why the evidence synthesis comes into play. So, for example, now yoga in heart problems, there are almost 40 clinical trials, 40 research studies done in a randomized fashion to see whether it is beneficial or not. So one doctor who is not aware of this entire 40 studies can take inference from only one study and say like this is not working. And there may be another doctor who may take another study and say like this is brilliant, this is wonderful, you should do every of the patients should do it. But that is the place where we have the synthesized information. That is where it is lacking. And the second thing is whether you accept it or not, even the super specialty doctors do not have training in this lifestyle aspects of health. They do know that, yeah, it may be a causal factor, but how to address this issue, they are not trained at all. That is why even in developed countries like America or even US and UK and in several places, after super specialization, after a cardiology training or after a neurology training or things, people are going for courses in lifestyle medicine to learn about that now. Because in India, we have the luxury of yoga Shibu doctor who can be, upskilled for this activity, specifically trained for this activity kind of. But in US, they don't have that luxury. So the doctors are taking that additional, pain in learning that and implementing in their patients. So there are several places where they are having this regular, regular training for that lifestyle medicine. It is, it is pitched upon. In India, I can say like, just 2-3 weeks before, AIMS Nagpur started this course on lifestyle medicine for allopathy doctors, for modern medical doctors, because it is, it is a need of the hour. They have to learn about this rather than, to put it bluntly, they cannot make a fool of themselves, right? So they have to understand the complete context for sure. And at the end of the day, everyone will have some preference over the other. So there may be, that, individual preferences coming into play. But in terms of evidence is evidence. When you read, I read, or anyone read, evidence is evidence. That's a way we should go forward. I hope I'm answering your question, sir.
And doctor, I would like to add something there. This Dushi.
Yes, sir.
Sir, so now coming back to, okay, so doctors generally they keep themselves updated with respect to different updations happening, because as a layman, like we don't know that we don't know what we don't know. Like there are different things to it. Now coming back
Yes.
to say once we ask for a consultation, there is like fear induced among the patients, because see at the end of the day we believe that say whatever they are telling, if we don't follow, then we shouldn't regret. or we follow for that. Though we are not 100% sure it will work. Okay. So now coming back to this yoga, say one is doing it preventive. That is having it followed like previously. I mean, from a very young age. That is one. Second is once during this particular state has happened, because certain people who would consider them very fit until yesterday, this could a heart attack could happen to them. So it could be I mean, whatever is the root cause, we still, there are no concrete studies to know that. So what I'm asking is, yoga, if someone practices really well, could it avoid it? Second is, say with reference to different tie-ups for this yoga and all that, because certain people don't want this to happen, because then their importance will be lost. So with respect to, but people who are benefited from it, then more people will give more importance, like just like word of mouth. And so this is the way ahead, is what I believe. What is your opinion on this, doctor?
Thank you for bringing in another aspect of intended avoidance of rehabilitation among the experts. Like I think we don't have to speak about the morality or the ethicality of such practices. We don't have to like let us not go into that aspect. But the question of whether practice of yoga can prevent heart attack. Yes, there is a possibility. But as I said earlier, it is caused by multiple factors. Like to begin with, we spoke about 6 major factors, right? Diet, physical activity, sleep, and so on. One person may not have any of these 6 issues. Despite that, he could have got a heart attack, right? Similarly, a person doing yoga for hours together in a day may end up with a heart attack because he has factors at play, right? So you have to see heart disease as a holistic thing, addressing major, it is an end outcome of various things which is going inside that process. So addressing only one aspect with yoga, like the practice of yoga, is not going to strengthen it. We have to address all the issues which could be there. So that's why the complete transformation of the lifestyle change is required rather than addressing one facet of it. For example, in most of the exercise rehabilitation program, that also fail because you give only exercise. What about training for managing their stress? What about addressing their the dietary things, which is not there, right? But if you look at the benefit as a whole, it can change a lot. And in terms of evidence, there is a constant process of engaging this with the experts. So we also do some orientation program with various cardiologists about the holistic nature of the evidence, whatever we have in this is my area, so I'm taking this forward. So there are several platforms addressing individual domains, addressing that experts specifically, but it is not to that stage. And the other approach is reading people itself. There are platforms where you can go and read both scientific evidence, from a layman perspective. What does that mean? What does that evidence is about? So you can have an informed decision making. So that is also under progress in several countries. In India, we have a limitation. We have to grow to that level actually.
Yeah. Thanks a lot for the insights, doctor. So I shall try to get in touch with you, doctor. Thanks a lot.
Thank you. So before we move on to the next questions, there are some questions in the chat box. Let me just quickly see that. Blood clotting, happy moving friends. Avoid recurrence, preventing another heart attack. Doctor, what is the difference between? Okay, what is the difference between heart attack, cardiac arrest, and the symptoms and causes, kind of? Let me put it simply this way. Your heart is kind of a big muscular organ, right? When blood supply to one segment of that is stopped for any reason, then you may have something called as a heart attack, right? So in heart attack, there is a quick stoppage of blood for one segment of of heart or little more bigger area of heart. but it is alive. Okay, so it still functions. In a cardiac arrest, it is actually the electrical conductivity of the heart. Okay, so the heart will pump based on the electrical conductivity. Okay, so every time there is a place which will give electrical impulse and make the heart beat. When that electrical conductivity is failing, then you have something called as a cardiac arrest. Are getting it? So heart attack is about getting a block in the heart to a specific area of your heart muscle. Various cardiac arrest is around the failure of the conduction system of the heart, electrical conduction system of the heart. Heart attack can lead to cardiac arrest if that conduction mechanism is affected, is affected because of the blood circulation to the area which is actually, carrying that conduction pathway, right? It can be, it can happen that way as well. So the cardiac arrest over a long time, it stops the heart itself completely. So your gut is completely stopping in cardiac arrest. It is not going to beat anymore because of that failure. So in cardiac arrest, the chances of the recovery is really low. Whereas in heart attack, with the revised, the resuscitation process and other things, the chances of living is very reasonable nowadays. The modern medical emergency system has improved a lot. We will make them live, very long. We will not allow them allow that patients to die because we have several very good interventions which you can think of for this group of patients. We can we can go for what we call revascularization procedures. It means like your blood vessel is is blocked. We can unblock that with medicines, with your stenting, with surgery. We can do that, and we can make you live longer with those procedures. But for you to not get that problem again and to live a healthy life again, we need other things into play. Yeah, I hope I answered that question of Mr. Manikam. Then we have how good is ECG in providing health of hearts? ECG is one modality to understand how the heart functions. So, like as we measure blood pressure, as we measure cholesterol level, ECG is a tool for us to understand whether your heart is functioning good or not. What is the role or importance of micronutrients or supplementation? I would say zero to begin with, until or unless you have a specific deficiency. You have a specific deficiency as identified, maybe it has a value for sure. Even if there is no deficiency identified, supplements of any nature is not going to be helpful. In fact, studies have proven that taking such supplements or things like that is going to interact with your drugs and make you sick rather than getting better. So stay away from quick fixes like this. Micronutrients, you take it through the diet. That is more than sufficient rather than taking it in terms of pills. There is basically a market rather than health approach. And there is one more final question, I guess, about intermittent fasting. So the intermittent fasting is one aspect of of dieting. There are proven evidences for that, but still not in a bigger way. So when you do the fasting, obviously whatever the etiquette is required for the fasting, you should stick on to, and always consult a like a doctor who is available with you. So there's nothing wrong in going for intermittent fasting. In fact, it is it could be healthier, but the only thing is your strict monitoring is required when you are doing such kind of things, because in certain occasion, like we used to say, if you don't like hydrate properly, that itself can induce environment for another heart attack. Okay. So or at least a chest pain. So you take a glass of water before you sleep, that can reduce the chance of getting chest pain in the nights. So you have to be careful around when you deal with the intermittent fasting, in which you may restrict your water intake also. So you have to be careful around those things. Otherwise, I would say that is not bad to do. If you are comfortable with, you can try that. Nothing wrong in it. So, okay, there's another question just now it has come. Missing heartbeats common. Will this lead to heart attack? Generally, cardiologists recommend ecosprin blood thinner. Kindly share your views on this. The missing heartbeats, what we call this an fibrillation. Okay, we call that as atrial fibrillation or ventricular fibrillation, which is bad. Sure, there's no doubt about that. Okay. So what we give is something called as what the cardiologist give is something like a blood thinner. That's ecosprin. Okay, to avoid the blood clotting within that within the heart. So atrial fibrillation is one of the biggest risk factor for getting a stroke and other even worsening of the heart failure and things. So basically, once again, the issues around the heart is not functioning properly because of some issues. So once you remove the things which is contributing to that insult to the heart, maybe you can get better. So there's a recent study on specifically yoga and heart, atrial fibrillation, and it said it is doing good. So the physical practice, exercise, training sessions, there are several things, which has shown that atrial fibrillation can be managed effectively. It is something like you didn't exercise that hard for a very long time, and it is prone for this kind of issues. So if you make it, if you give a good exercise, it is going to come back to normalcy, right? So that is the kind of hypothesis what we are placing here. Okay, so I think I have. Okay, there's some more question coming in the comments. Should we break for the chat box and come back to the live persons here?
Yes, sir. Please, sir. You can, sir.
Okay.
Yeah. So any open questions?
Yeah,
sir.
I have to.
Yes, sir.
Hello. Hello.
Yeah, one at a time,
Yes, sir, please go ahead.
Yeah, one at a time.
Suresh, sir.
Yeah.
I'm traveling.
Suresh, sir, then Jawahar, sir.
I don't know whether the question has been asked earlier. Two questions. One is caregivers, like doctors, they themselves are highly vulnerable. Recently, a young doctor who is highly qualified in cardiac specialist, and he passed away at the age of 30. And even with Rajkumar, the case study with Rajkumar, was doing his yoga and exercise. During the gym itself, he has collapsed. So why this kind of thing over it? So that you have to know the limit when you have to stop. I don't know. That you can on that. Number one. Number two, why this BP, blood pressure and diabetic cases are highly vulnerable to cardiac.
Yeah. Thank you, sir. So let me answer the questions one by one. The first thing is about the caregivers. Yes, it is an important thing, there are two issues for the caregiver. First thing is they have to provide care for the patients and they have to care themselves as well because they will be in a biggest stress. I got a heart attack. I have a problem only to worry about me probably. My wife will be thinking about me and she has to find a way to heal her as well, right? Keep her at best, right? So the caregivers are under undue stress in most of the occasions. So a program like this is going to be beneficial, not just the individual, the caregiver, but this is a kind of you have to transform, apply this to the family as a whole. Now, for example, now you are changing the diets. At home, you are not going to change it only for one person, right? The entire family will go for the transformation. Okay, doctor said that taking vegetables is good. Let's take one more teaspoon of vegetables for everyone. Everyone should take this, right? That is an easy task for everyone in the family. Okay, now we have to walk. How are you going to walk? An old person in the family can take their grandson or granddaughter for a walk. It's a peer influence. It's a family, like kind of an intervention. So you can think of several things to take care of the caregiver at the same time, improve the individual health as well. And when you speak about the exercise intolerance or the issues, some people even yoga gurus are getting getting stents, cardiologists are getting stents, and exercise professionals are that extremists are also getting problems. Once again, you have to understand it is a multifactorial condition. you being good in one aspect, excluding or or not caring about the other domains of health, you are going to have the same risk as a common person. So, for instance, if exercising is the only thing which can prevent you, then none of the force people working in the force should have a heart attack. But they have the highest rates of heart attack. Why? They have alcohol habits, they have tobacco habits, their sleep is poor, right? So this has to be, seen in a holistic fashion than telling like, okay, the yoga is not working, exercise is not working. Rather than that, we should say like, he failed to, address other elements of care, other elements of health. So maybe that's the way we should see it, I guess. And the last question, I'm sorry if I'm missing. How the high blood pressure and high sugar is going to contribute to the cardiac problem. So, although we call it a physiological risk factor, the high blood pressure or high sugar, that is also an outcome of failure of our lifestyles. So when we address a lifestyle, it is basically, kind of one step earlier to the heart attack. The lifestyle, which is not adequate for a very long time, initially could lead into some risk factors like, hypertension, diabetes. So these are the offshoots which can be controlled with drugs for a better outcome. But even without that, they may end up with a heart problem. So if they have it, we call it as a shared risk factors. So basically, it is an outcome of the big risk factors over a long time. I hope I answered all the questions. Then,
Sir, I have one question.
Chandrasekaran?
Hello.
Sir.
Hello. No, I just want to add one question.
Yes, sir.
Suppose if it is a diabetic patient or a BP patient, still the patient will get a sign or a kind of signal before a heart attack, or something like that. It will happen, something like that. There is a warning, or it is a sudden thing could happen.
You are asking about something like an early warning sign, which I can sense before I get a heart attack. For heart attack, we do not have anything like that, sir. It can happen any moment. But we strongly suggest you keep your risk factors under control. If your blood pressure is around 130/80, or the sick control, which is like 130/80, your blood sugar level less than 100, your chance of heart attack will be very, very normal as like a person without this, problems. Right? So that is the early warning sign we can say. If your blood pressure is not controlled, you have a heightened risk. But once again, that heightened risk doesn't mean we are going to get a heart attack tomorrow or in the next month. Once again, it may take years to set. So the pathogens is very complex.
Hello, sir. This is regarding generally whenever we do a medical test, we find that vitamin D and B12 are the commonly lacking. And my doctor said that it is very common amongst most of the Indians. So is this really responsible for any kind of heart disease, or is it good to take vitamin supplements to prevent the same?
No, in terms of evidence for vitamin D and vitamin B12 supplementation, the evidence is once again is hazy. It's not very clear, but the biological rationale strongly suggests yes, we need sufficient amount of vitamin D, whether it is in the midway, yes, of the disease progression, it is there, and even B12. So vitamin B12, there are very limited sources in terms of your vegetarian diet, especially among those people who are doing, following a vegetarian diet. This is going to be a problem. There are some supplements, specific about the vitamin B12. If you take multivitamins, I don't think it's going to be a benefit. Specifically, vitamin B12, it may have a value. And in terms of vitamin D, 10-15 minutes of sun exposure is more than sufficient, rather than a pill. That 10-15 minutes of exposure is going to have multitude of benefits than one pill. We would strongly recommend the other way.
Thank you, sir.
Sir,
I have a question, sir.
Yes, please.
Sir, sir, can you please share few asanas and breathing techniques for overall heart care, sir?
You know, if you ask specific practices, like we have made a bucket of practices which are, safe. There are several things. But ultimately, it is not about one or two practice. It's about having that, the purpose of yoga is about to inducing a relaxation response. So I would strongly recommend you to, we can share the link, whatever the materials we have it, we can share it again
Please,
to,
please,
Mr.
kindly
Sir.
share,
We'll
sir.
do
Right,
that part. You can, get it
right.
from there. Yeah. But I would strongly encourage you to take it under the guidance of a professional to begin with.
Okay. Thank
Dr.
Good
Shamna, please go
morning.
on.
My name is Muthukumar. Can I say something about this yoga practice, sir, if you don't mind?
Yes, please, sir.
Hello. Some gentleman asked about the yoga practice.
Yeah, please go.
The biggest challenge
Just inform
for
me.
the yoga practice is that it is not defined the way it is currently done, sir. If you look at the yoga came from, everybody know, from Patanjali or from Atanga Yogam, it is not just one. It's only one part of the entire yogic practice. It's only a third of the total 8. And what clearly yoga says is that if you do not practice the 1 and 2 and 4, just yoga is a physical exercise. There's nothing different between walking and doing yoga, doing exercise, or jogging. And of course, yoga has become very, very famous in the world because of corporate and money making commercial business model. But if you really want to practice yoga, which will help obviously in the holistic health, including, as the doctor was already saying, we have to ensure that we follow the entire practice of the Ashtanga Yoga. Then only the actual thing comes. So if we can look at what is Patanjali's Ashtanga Yoga, it is available anywhere. A lot of books are written, a lot of materials are available. And without doing that, sir, just a yoga is just an exercise. It doesn't help anybody. It doesn't help in any health improvement. And we can discuss it later offline, but this is just a point for sharing, sir, for your question. Thank you.
So thank you very much for bringing the different facets of yoga. So there are several schools of thought, and one of the most renowned school of thought is the Patanjali Yoga School. So the Ashtanga Yoga, excuse me. So the idea is like it starts with yama, niyama, pranayama, asana, pranayama, and so on. So excuse me, I'll take a glass of water, please. Okay, can you hear me now? Am I audible?
Yes. Yes,
Yeah.
carry on.
So, as you rightly added up, our rehabilitation program is informed by Patanjali, school of thought. So we try to address all the facets, not just, as we are speaking, the yoga, the asana part is just the physical aspect of it. Even in asana, when you don't bring awareness, it is nothing but a physical exercise. The bodily awareness is an important part. So that's why I was telling the other person who was asking about the specific yoga practices. So it is not just, that naming the practices and doing it. It's about actually bringing that sense of bodily awareness during the asana. And we have pranayama and we have meditation. In addition, we have the basic sets of principles of healthy living. That's like yama and niyama. So 5 each. So we bring everything into that context. In a modern way understanding of life, we are putting all these elements together and bringing the best of the package. So this is how our work is about, sir. Yeah, there's a hand rising.
Yeah, nice to see you, Dr. Chandrasekaran. This is Shyamala Mani here. Lovely talk. Very interesting. And I've, of course, heard you so many times before. I just had one question, which I thought might interest the other listeners also. It's about, stroke rehabilitation. Is that, because in stroke rehabilitation, we find that, the aspects of physiotherapy, because there is a certain amount of, strength building, in a way that one particular side or one particular part is strengthened more. So whereas in yoga rehab, it may be good for cardiac rehab, but in the stroke rehab, when you have to also integrate certain portions of physiotherapy, has it ever been tried? Or are you planning to do it, or do you have evidence for that? Thanks.
Yes, ma'am. Stroke rehabilitation. Thank you, ma'am. Ma'am is my colleague at the Center for Non-Disease Control. I didn't see her. I'm very happy to see her here. Ma'am, as you are aware, just a month before we had an what we call a brainstorming session on how to improve stroke rehabilitation in the country, following the similar principles on cardiac rehabilitation what we are doing. So stroke is little different in terms of two aspects. One is the neurological loss, the neuron deficits, whatever we are going to have with the stroke, cannot be reversed that easily. That is one thing. So your heart muscle which is dying can be supported by the rest of the heart muscles. So we can bring back the deficiency to good amounts. But in stroke, it is not the case. A set of neurons dying, you died forever. It is literally impossible to get that back in a short time of, in a shorter time, like 3 months, 6 months, or even 1 year. It's not possible to bring that one. So we have to speak about, technically there are so many things we get to, work around. There are some minor studies did on that for a long time, things to look at whether the neuron deficit can be, addressed. Then the second thing is the heterogeneity of the, needs. You could have seen stroke patients. One patient will have a stroke which is affecting the upper limbs. One patient may have a stroke which could have affected both the legs. One patient would have seen, one side of the body is affected or the other side of the body is affected. One person will have speech issues, one person will not have it. So a generic rehabilitation for stroke may not be adequate. So we need tailored, a little more, further tailored requirement is needed in that case. So we are working on preparing a generic module plus need specific stroke rehabilitation. So we are in consultation with various experts across the country, and also we across the globe. We have some collaborations from University of Leicester where I'm doing my PhD now. So we are working on that aspect as well, but it's just we are too infantile to comment upon that the benefits. But minor studies, as usual, pilot studies have demonstrated some benefits for sure.
Thank you so much.
Any more questions?
You are in the meeting. Okay, now I have another question for, like many of you are, I have been told that this is a group of entrepreneurs. Now, making this as an entrepreneur model, like if at all you were in our shoes, how do you think of capitalizing this benefits or the societal, societally relevant activity into a commercially viable product? If you have any suggestions or things, we'll be very happy to hear from you guys.
Not only entrepreneurs.
Do we have any other question from the group?
Hello.
Do we have any other questions from the group to the doctor?
Yeah. No, this
Yeah,
what
go ahead.
Dr. Chandrasekaran was telling. Not only entrepreneurs, people like us. I'm a freelance professional. So the dietary system is very bad. Sometimes we skip the breakfast. Sometimes late night we work. Travel, a lot of travel. Stress as usual. So this kind of lifestyle, even aware of the vulnerability, but we cannot avoid it. So what are the precautions you suggest for this kind of entrepreneurs or the freelance practitioners?
The question is for me, right, sir?
Now you asked for it, no? That suggestions were you're asking. So these are the problems we face. Not having regular diet or sleep, or not only for entrepreneurs, people like us. Maybe so as long as I was working 9 to 5, it was different. But now I have a lot of commitments and freelance work. All of a sudden there is a call for a meeting or something like that. Now many a time I skip my breakfast, or I have my lunch directly at 2 o'clock, 3 o'clock. Most of the entrepreneurs, those who are in business and travel and all that. So, what kind of a regulatory system you suggest? Minimum regulatory system.
Whether it is working or not, I don't see much difference, because it is about us how we are bringing that self control. For patients with heart problems, we first suggestion will be like, speak with your employer to have that flexibility of having that flexibility towards how are you going to balance your work and your things. It's the same for our entrepreneurs as well. It's the same thing. So you have to find your own time, and you have to find a way to manage this. It is just about the self care. So you miss walking in the morning, do it in the afternoon. You want to skip the you are skipping the food, just take a apple or something, just go ahead with that. So it is always about self-care. There is always a possibility of flexing it and making it forward. But my question for the entrepreneurs is, like, for example, we have a set of naturopathy hospitals, we have the cardiologist units, but still this program is not escalated widely. How we can make this as a viable product? If you are if you are in our shoes, how do you upscale this project?
Yeah, I would like to
Yeah.
add something. There's
Yes,
Dushi.
please.
Yeah, so one is if you look at what is happening, like I think the whoever has lived like 50 years back or whatever earlier compared to the current way it is. I mean, be it sugar levels or this diabetes or whatever it is, or the issues. I mean, the heart attacks or whoever are getting it's much earlier. So the awareness or the way it is, the balance of life. That's the reason many corporates or many companies are giving more importance to mental health and other things. As you know, as you also told, whoever is working out also could get it. At the end of the day, balance is important, and that awareness is to be made to reach. So the work organizations, because everyone are working at the end of the day, that I mean, whoever can care about their employers could care about their employees. So that is one place where it could be done, just like how they are doing insurance and all, right? But everything that are related, I mean, way it is, the market is set such that that is the way it is happening. It is only increasing. People are exploiting or people are using that, and that there is no way. Even insurance companies or different way it is happening. So one thing I would like to see the awareness is, first of all, this kind of work shouldn't be given to everyone. Only who is passionate on to be done that particular, because otherwise it's easy for someone to point the loopholes, especially the people, the be it the top people or who are creating fears in the people, and it's easy. So most important is whatever the documentation, whatever whoever is driving this, proper documentation and the right way it has to be implemented, and to the people who are passionate about, so that it shouldn't be in wrong hands. That is one. Second is, all companies, they value their employees because they are getting multiple work from each and every employee. So in that way, just like mental health initiatives, so other service organizations, these can be added, and easily it could reach the common man. So this is another thing which I believe that it could make a difference. Then seeing by this, see, the word of mouth, they say. So seeing these benefits, automatically it would reach. It will probably inspire a lot and all that, because now it is not done in an organized way, structured way, and certain people, even inside they don't want this to be successful, because then their say or their business could get affected, and also their people won't listen to them. So I believe most important is in doing it in the right way, and to make it make people aware, and also make it preventive, because rather than something happening and then someone going for it, then already they can't get the, because as you know, once the heart stops and all that, then whatever cells can be got back to use, how much percentage of them, 70% efficiency they can work, or whatever it is. So what I'm trying to do is, though all the sits of these, or whatever you told, right, sits balance, all these to be made aware to people. So that is what. So once information is given, people are aware, then more importance it would be given to their lives. Yeah.
If I
Thank you
may
for your
come in,
suggestions.
my name is Muthukumar, and many of the attendees may know that I am writing a book called "You Are Your Own Doctor" from an engineer's perspective. So the biggest challenge is that from a holistic approach you do with humanity, the challenge that what you mentioned about is, irrespective of what you do about raising awareness, talking to them, teaching them, fundamentally the humans are taught to be progressive and with a positive elimination process. From childhood, from very young age, from the schools and colleges and universities, society, organization, wherever you go, you are taught to be positive. Always think very positive, always be positive, always do everything with a positive elimination process. They never taught the other what if alternate, taught by Sigmund Freud. Only one guy talked about it in every length. Nobody's taught about it. So even today, all the people who are sitting in this hall today, they will be thinking only positive elimination process. Every one of us, including me. It's not that somebody is out. That's what we are trained for. So what happens is that in your progressive mind, you don't believe that you are possible, that you may get into trouble. We see people dying every day around us by heart attack or any other very bizarre word incidents, a lot of diseases. Look at the amount of liver-based diseases, and people die because of liver cirrhosis, non-alcoholic. Today, non-alcoholic liver cirrhosis is 60% compared to the alcoholic liver cirrhosis because of its high level of sugar and fructose. So people are today seeing that happening around you, and nobody wants to learn. Even somebody from the family dies of heart attack or liver cirrhosis, nobody wants to learn because they are taught to believe that nothing will happen to you. The sky is the limit. But the reality of life is not like that. Reality of life is always about what if alternative. And this is the learning we have to have. Once you start thinking about why it should not happen to me, the wrong thing. Why it should not happen to me? What I'm only that self thinking and contemplation modify the model of progressive approach, be positive elimination process, but go into something called reductio ad absurdum technique, which is actually talks about what if alternative. Once you ask a question, that's exactly what Upanishads teach us, to look at the other aspect. Don't be very positive. Look at what is there, which is an alternative. And that exactly in Adhyasa Bhasha, Adi Shankara teaches us. We have a good systems. We kind of buried everything under the superstitious rituals and festivals and things like Kumbh Mela and all these things without asking any questions ourselves. So we're all positive. If you go to a temple, thing will be all right. If I pray for you, it will be all right. You'll be cured. Everything is a positive elimination. Nobody thinks out what is other alternative. So people, if you look at people don't take medical insurance, people do not cover themselves for protection. People take so much of EMI, and so everything, you look at everything is stress creating factors in life. So to answer your question, how to do this, fundamentally, we have to really take small groups of people only. You cannot elaborate everywhere because nobody's going to listen. Irrespective of commercial models, be successful. People lie a lot. People create a lot of climb and hype, and people produce a lot of YouTube videos saying that somebody is cured of this. All are lies. We all know that is not. Many of them are not truthful. Maybe there are 10-20% of reality truth is there, but 80% of the claims are hype and for commercial exaggeration and marketing. But instead of doing that, start with a very small group. That is the only solution, 100 people or 150 people, and establish in the practice of understanding that why my health will not be affected, what I'm different from other people, why I think that something will happen to other people will happen, and continue doing the same mistakes again and again and again. That model, I know it is difficult to discuss in this meeting, but that kind of a model is the one is tried today from the holistic wellness plans. So we need to have an integrative holistic wellness models to make people understand that what if alternate solution. And if we don't do that, this will continue, sir. Maybe 10% of the people will realize and follow that. 90% will continue doing whatever they're doing. Nothing will change them, irrespective of what is happening. So this is the reality. So the first step is to understand the reality of the situation. Second step is to go from step by step, understanding and making people to realize it, not in a bigger way, not creating nobody's going to get self-awareness at all, irrespective of how much books you publish, how much videos you put it, how much papers you give it to them, but make them understand the what if alternate scenarios from a psychological perspective. And this is a long topic, big topic, but just a short discussion from here. I'm happy to discuss offline. Thank you.
Thank you, sir.
Do we have any questions to Dr. Ambalam M. Chandrasekaran?
No
Group?
questions. Only one suggestion for his
Okay.
suggestion. Dr. Chandrasekaran. Hello. See, one more thing.
Yes, sir.
This is a suggestion. Last time when the Velangani festival, planned, usually every year it happens. In Kadalur and Nagapatnam, we used to have the joint directors meeting of 5-6 districts, because the crowd would be around 15 to 18 lakhs of people would gather. Okay, so they extend the invitation to the private practitioners or forums like yours to come and have a health post. So to avoid any kind of casualties or any kind of problem, so they invite the doctors. So you can think about wherever this kind of crowd gathering is happening in the temples or churches or the place of worship or any kind of this thing, you can have a health post which could be a kind of facelifting of your forum. Would you think that will work?
Maybe, sir. There are, like even, we are researchers, so speak of evidence again. So there are evidence to say, like, that the places of worship can be used as a model to, use it as a, leveraging platform
Not
for
only that,
improving
as an
health
emergency
behaviors.
center, as a health post, as an emergency center. So even from Tanjavur, we had one clinic, and regularly they are coming every year, and that's very, very popular. And then remember we had the center or something like that. So you can think about any not only place of work, wherever crowd happens, so you can help post where you can have kind of facelifting. So I think I come across something like that in 2-3 clinics in Tanjavur, Nagapatnam. So I just suggested. So whether it could be a possible solution for you also. Especially we never had.
Actually, there's one question in the chat box. That is true, sir. We can think of one. Like there is one question which I missed in the our chat box. My husband is a regular yoga practitioner. Recently, he had a setback because of missing hurt backs, and after hospitalization, he has been advised to stop yoga. This is from someone. So, two individual prescriptions cannot be suggested at this moment. We do not know what kind of yoga your husband was practicing. So there's a possibility it could have caused harm, because not all yoga practices are safe to the heart. So we can take it forward if you are interested in a personal chat, ma'am.
There is one more question in the chat box, which is from Sirish to everyone. What medicines would you suggest in an emergency one should have at home? Thanks for the informative session in detail.
Yeah. Okay. Yeah. So recently came. Good. Okay, once again, this is going to be highly contextual. See, you cannot prescribe any medicine for anyone, for everyone in general. For example, we call something as an anti-anginal. For patients who had already, got a heart attack or established coronary artery disease patients with a lot of block, we will, the cardiologist will prescribe something called as the anti-anginal medications, which can be taken when you are getting that pain. We call it as SOS medicines. Whenever you need it, you can take that medicine. And there's a proper process for taking those kind of a medicine, which is an emergency medicine, which can relieve your anginal pain. Basically, it relaxes the heart muscles and improve the blood circulation to the heart. So that is a function of that medicine. That itself has several categories, several things which has to be prescribed based on the individuals. So we cannot, prescribe it for everyone, as a whole. So the individual prescriptions are very, very, very crucial in this. So I'll leave it there.
Hello,
Thank
my
you.
name is Parthiban actually. Sorry.
Go ahead, please.
Okay, thanks, sir. Thanks for the beautiful, informative system. Actually, informative lecture. Actually, I went through a procedure 3 months before, and whatever you discussed, I was a regular yoga practitioner, and my side is actually I am lack of sleep as well as I was a smoker before. Actually, I ceased smoking after this. These are all actually I suggest there is I went through many of the district medical colleges. There is 3,000 rupees. They will do the checkup. Every checkup they will do. That kind of initiative the government has already taken. In the Ayush also, they have taken a lot of other initiatives. Actually, we can join together for entrepreneurship. I think I'm talking about this. So it will be useful and it can be subsidized and given to all the public. Now people are aware that they will go for medical checkup for after 50 or 40 or something like that. They are doing it. In every medical college, there is a separate block doing this medical checkup. Last time we had to go to Apollo or any other things. Now you can go to government hospital, and the government hospital, it is a very hit program actually. In 3,000 rupees, they are getting everything. In that, actually, you can add your services. Whoever want to join, they can join. For me also, I need some kind of very good counseling or something like that. Or I need some doctor support every now and then I can talk. This is what I want. This you can address. And I'm running a company of about 300 people. I always in the morning we have an exercise session as well as we have yoga session. We always do that. Thank you very much. Bye.
Thank you, sir. To add
Madam,
on
can
to
I
whatever you have shared, I'll
make a
share.
small contribution? Mr. Gopi, madam, can I say something? Can I contribute something?
Yes, please go ahead. Thank you.
All right. There is a controversial model about this. All this the parameters medical checkup, sir. Most of the defined average, they are not normal. For example, whether it is blood pressure, cholesterol, diabetes, they are all not normal. They are actually mean averages only. And the problem they all came from studies happening anywhere. It is one of the major, which is emerging, and is a model in the world actually in the integrative medicine. So whatever you go to the lab and take a test. In fact, these tests actually created more patients in the world than non-patients. Because what happens is somebody who goes there and then look at it, there's a number of 100 for fasting sugar, 140 for postprandial. They say suddenly somebody's having 110, 120. They say you are pre-diabetic, start this tablet. That's a lifelong they use the tablet. Nothing happens to them. There's no cure for diabetes. And same thing with cholesterol. They say, okay, there's a number for your LDL, number for your total cholesterol, whatever. And then immediately you are crossing the limit. They start giving you a tablet and start doing. And the cholesterol tablets has the highest side effect, and this also becomes a lifelong medicine. Same thing, no one knows whether it's a 130 by 80 is right or 120 by 80 is right in the world. It's all in a mean average model then based on studies done, and doesn't apply to the race and ethnicity. Especially ethnicity is completely different. And most of the surveys for this done in the US with populations, of course, they do a lot of controlled research with the various ethnicities, but again within the ethnicities also. What happened today in the markets are the advice from the integrative wellness medicine people not to take this regular routine medical test, because the doctors will just give you prescribed medicines, make you a patient. So moment you go for a test, you come out as a patient, whether you are a patient or not. Every individual is different. If you understand one thing, what I'm saying, you may not agree with what I am talking about, but if you look at anything you take, blood pressure or LDL cholesterol, anything, diabetes, go to Google and type out that how this was identified and how this number of 100 was given. You go back to some kind of research, even you ask ChatGPT or something, it will give a graph and show you very clearly that there is a blue curve method of calculating the average, and you may be totally out of that average. Not necessarily that every one of us will be within that average. Your body can be extremely healthy even at 130 sugar level. It is because of your base foundation of the body, but then unnecessarily you're given tablet and everything out. So it's what is in the integrative medicine today, which is a new technology started around 2021. New doctors are coming with integrative medicine. What they talk about is that it is not about, they look at all the entire metabolic syndrome as a whole, instead of just taking up one particular test, and then they don't even prescribe tests unless your metabolic syndrome shows some kind of an activity, which is combination of several aspects actually. So although governments do it and a lot of hospitals do for commercial purposes, since we are discussing here about holistic health, it's an interactive session. I am also cautioning that just going to a lab and doing a test is not the only way better, because it is not always the right thing, sir. So please consider it as a holistic model. Thank you.
Sir, to follow, can I add?
Absolutely, sir. Please do that.
Am I audible? Yes. Yeah. Sir, I beg to differ from you on, several schools of thought, what you have suggested. The first and foremost thing is, like, let me give an example of blood pressure. So the suggested recommendation of 130 by 80 is not based on average, sir. So, it's based on average on a different way. Let me explain. Let me try to give 1 minute for that. What we compare in that is, for example, now you have 1,000 people in the population. 100 people are having a average blood pressure of 90 mm by 60 mm. And another 100 is having another 500 is having around 120 by 80. There are 100 people who are having more than 140 by 90. So we have several segments, right? Several group of people in this regard. You follow these group of people over 5 years, over 10 years, to look at how many of these individual group of patients are developing cardiovascular problem or they are dying. This is how we do the research to understand the risk factor. And in this, is all the patients with 140 by 90 is going to die? Not at all. But we compare the risk of this incidence among these groups, and we speak of that relativeness of the risk. So compared to those people who are having a tight control of 120 by 80, people who are having a blood pressure of 140 by 90 over 5 years are going to have an elevated risk of death or heightened risk of getting another established cardiovascular disease. This is what research is suggesting. And when you speak of the individual risk, we always, as the public health researchers and, whether the, what we call, health system approaches, we speak of frequencies. We always speak about 1,000 people in a people of, in 1 lakh, what we are going to do. In a population of, in the entire country, what we are going to do. But increasingly, there is another way of approach coming, which is the precision medicine or the individually one. Okay, in this level, in your, like for example, in my case, if I am the patient, I am having the blood pressure of 130/90. 90 is elevated, not 130, right? What is my risk of getting a hypertension over 10 years? Risk of having a, cardiovascular event over 10 years. This is going to be a different approach. So when we mix both the things together, it is going to be a not a best example to speak about. So whether the precision medicine is improving or not, yes, absolutely, we are improving in that aspect. So what are the triads which is changing that personal behavior, personal variation in that particular thresholds for blood pressure? No, there are discussions, there are signs, there are things which are improving for sure, but from a health system perspective, when a government is making a decision, when a large number of doctors are have to be uniform in caring the patients, we need to make some certain rules, right? Okay, beyond this, think about giving a care, which is going to have some lot of benefits. So, in a nutshell, in the last, we weigh benefits over risk in a population approach. So, when the risk is low and benefit is good, obviously that particular approach will be recommended for sure. Whether it is blood pressure to blood glucose level, or the cancer management to anything, or even the preventive approaches. Even the preventive approaches, there are evidences to state that you monitor your indices, the basic indices thoroughly. You don't have to worry about, not worry. You can be certain that yes, you can avoid the unexpected cardiovascular event. That is the evidence around that. For example, you are having 140/90 at the level of at the time of your screening. Yes, obviously risk is higher. So you have to make the change for that 140/90. You say that there is a higher prescription rate, or making the patient as making the person into a patient, making them as a customer. There's are limitations or the kind of long-term issues. It could be a possible issues, but does that patient with 140/90 need a care? As per the population approach, yes, definitely he need a care. So this is a kind of a difference. I would I like differ from your suggestion, sir.
Yeah,
And
great
when
discussion
we were
actually. In
speaking
fact,
about the previous,
very
yes,
good to hear from your point of view. But there are a lot of debates and controversies today, sir. Because before, for example, 10 to 20 years back, this kind of debates were completely curtailed by the pharmaceutical companies and commercial people. Today, with the opening of a great, especially with the internet and the current model system, a lot of researchers and everybody is coming up very openly. If you go to, I can quote a lot of research papers today to you against this model of doing things. So the debate is raging. And I agree on one aspect what you're saying. When there are 10 million people in a country, a government has to take a call, and then they can't just treat everybody individually. So it becomes a collective a decision, which is I agree with you from a social perspective, because it is practically very difficult for any government to prescribe something as for individuals. But that is from a societal perspective. I agree with you 100%. Something has to be done as an average model. But the moment you use average, and that is where the debate is coming. And if you can share with me later on your email, we can discuss it offline. I can also forward a lot of research papers which actually talks much details about even the bias about the survey, the study done, the ethnicities people are taken. Today, before, pharmaceutical companies will hide the details of a survey. And then today it is available. Nobody can do that. Today everything is available. People have taken up, the survey is taken up by many pharmaceutical pharmaceutical companies for any kind of a medicines and tablet. And nobody can deny the fact that the cholesterol tablets have extreme side effects to the people, a lot of side effects. And then the cholesterol, LDL cholesterol numbers, and everybody agrees in the system that it is not one number, and there is no need for us to go to immediately tablets. It's not a highly risky number. A lot of other issues with LDL cholesterol, including the size of the cholesterol and the number of cholesterol, which is creating all these things. People have gone beyond the fasting sugar into fasting insulin today. Nobody's prescribing today in India fasting insulin. But today, the current thing is you should not do fasting sugar. You should do fasting insulin and postprandial insulin. Look at all the four of them and then take a decision. But no doctors today in India prescribe fasting. I tested it myself, sir. Last time I went there, I told my doctor, I want to take fasting insulin, not fasting sugar. He was totally zapped. He said, why are you doing that? So I want to know what is my, this is the latest one. I showed him the paper. I showed him the research. I showed him everything out. This is the basis of it. I want to try it. What is wrong on? So when I went to the lab, they're saying, we don't do fasting insulin here because no insurance companies covers that one. So you have to pay so much of money. So I paid 2,000 rupees, something only for fasting insulin and get it done. But the practice, I wanted to try it because nobody is trying to do that. So there are a lot of things are changing. And I agree with you on several aspects, what you mentioned about things, but at the same time, the debates are raging. And I think it is important that at least educated, well-informed people can get benefit out of that. And then you can give a choice to the people what you want to do. And of course, sorry for taking the time, but these are great discussions with you. I'm happy to discuss offline, doctor. Thank you.
I would like to
Sure,
comment
sir.
something
Looking
here.
forward to conversations.
I am just trying to comment something.
Okay.
To Mr. Muthukumar's experience. So anyway, Dr. Chandrasekaran, great, because I am a practitioner. My wife used to run a yoga studio called 136.1. She also, she practices Ashtanga Vinyasa Yoga. Like takes about 2.5 hours. It's a very physical form of yoga. So I also used to do once upon a time. Sir, Mr. Muthukumar, the real thing is laboratories and doctors, they want sick people. Actually, they don't want healthy people. It's counterproductive for them. See, it's like, it's like going to a car mechanic. Most car mechanics will know only to, a broken down car, he will know how to, repair it and get it back on track. If you ask him healthy, you take a brand new car from the showroom and tell a mechanic, please make it into a race car, he will not even know what it is. Same way, if you are a healthy person and you say, do test for me, or go to Dr. Chandrasekaran and say, please make me healthy. Most people will not, most doctors will be clueless because they are accustomed to treating sick people. They don't know how to treat healthy people. So I think we have to look outside of the medical profession. In fact, they'll dissuade you from, doing healthy things because for them, it will affect their practice actually. So they want sick people. It's like a number game for them. So this is my comment.
Thank you, sir. Thank you, sir.